I'm Bill Cunningham, the Great American, and this month is National Prostate Month that Tony Bender celebrates. And as you know, Tony has a prostate buddy, a check that they do around the first of each month. And so Tony has a very close, intimate friend of his that they check each other's prostate to make sure it's functional and things of that character. National Prostate Month, and one of the great experts in urinary care and all those kinds of things is Dr. Gary Kirsh, and I see one of his associates in Norwood all the time at Urology Associates. And joining me now is that same Dr. Gary Kirsh. And Dr. Kirsh, welcome again to the Bill Cunningham Show. And Gary, how are you?
Good, sir. How are you?
I'm doing great. Let's deal with some fundamentals. I asked women up and down the hallway here, did they know what the prostate is? And almost all of them say I have no idea, but we know it's something. So for those who are uninitiated, can you tell the women of the tri-state what is the prostate?
Well, the prostate is a gland that sits underneath the bladder, and the urinary channel goes through it, Bill. And in health, the prostate makes an important liquid component of the semen. And but there's another reason that men have a prostate besides making an important component of the semen. And do you know what that is, Bill?
Well, I mean, it gives you a lot of pleasure.
It does, but also another reason men have a prostate, Bill, is because God loves urologists.
So in other words, it gives you something to do.
Exactly.
Without that, you'd be in trouble.
Totally.
And of course, a woman asks me, why doesn't a woman have a prostate?
The woman doesn't have a prostate because God loves women more than he loves men.
All right, now, as far as the prostate exam, I had one recently, a week or two at your facility, Dr. Kuhn, one of your great associates. He said my PSA is like 2.6, 2.7. I go in line. Guys my age should be between 0 and I think it's 6 or 7. And so for a guy in their 40s and 50s, what should the prostate be, the PSA number?
Well, it should be in their 40s and 50s. It certainly should be under 4 and maybe even under 3. Depends a little bit on the family history and the size of their prostate.
Now, Tony Bender is about 75, and he's got like a 5 and a 6. Is that normal for a 75-year-old?
It certainly could be, yes, sir.
So what is the key as far as indicators of prostate cancer? And two of my buddies have had prostate cancer, and that's why I'm on this thing more than normally I would be. But what are the indicators that you don't want to get when it comes to a prostate that's indicative of a cancer?
Well, unfortunately, a lot of times, most of the time, prostate cancer doesn't have any symptoms that a man notices. Just because they may have weakening sex life, weakening urinary stream, this usually has nothing to do with prostate cancer, which is usually silent. And that's why the screening with the examination and the PSA is so important. And if I could just mention one other thing, Bill, and one of the reasons that I wanted to get this message across today, September is Prostate Cancer Awareness Month, and we're now experiencing a double whammy in that men presenting to the doctor with prostate cancer now may be presenting with less curable disease. And this is because of a combination of some government action years ago discouraging PSA testing and the COVID pandemic where nobody's coming to the doctor anymore.
Explain that, because in the end of March, there was a governmental decision made to empty out the hospitals to get ready for this influx of COVID-19 patients that frankly did not happen. And so once you get out of the routine of seeing a doctor, it's hard to restart the process. Well, what's been the danger the last 6 months, whether it's breast cancer, any kind of cancer, or treatments thereof, or prostate cancer? Well, what's been the unintended result of the COVID-19 shutdown?
There is no question that the shutdown has resulted in less prostate cancer screening. Not only are PSA tests down, but I ran through the data in our own practice, and even when you take into account, sure, everything was shut down during COVID, which, one can debate, but you would have thought that once everything opened back up, that we would have recovered those patients back to normal levels, but we haven't. Our prostate cancer biopsies, for example, are down 25% year on year, even taking into account the recovery period that we've had since the governor opened Ohio back up. So we are very concerned that the shutdown that occurred sent a message to the public that it was dangerous to go out of their house and go to a doctor's office and receive routine care. And in fact, they're still not receiving the care they need, in my opinion.
So at the urology group, you're seeing a decided fewer patients, despite the fact there's no less cancer.
That is correct. We are seeing fewer patients who are undergoing fewer tests to look for prostate cancer, and this is going to mean that in a certain period of time down the road, they're going to show up, but they're going to show up with more advanced disease that's going to be less curable.
Now, as far as going forward, if that happens, that's going to have some terrible results, and I'd like to encourage men, especially in their 40s and 50s, to get it done. If one goes through a PSA, and say you got a 20-year history of PSA, it's in the 2 to 3 range, go up to 4, come back to 3, and you have the physical exam all the time, does that give you like a 99% certainty that you don't have prostate cancer if you go through that on a regular basis?
I wouldn't go as high as to say 99, frankly, because there are some particularly unusual and bad actors in prostate cancer where the PSA just doesn't really reflect what's going on, and the exam may not. But it's certainly going to be, like 90%, 85, 90%. I mean, there's only so much we can do in life to protect ourselves. But if we get the screening, as you suggest, we're going to go most of the way to protecting ourselves.
So the screening is awfully important. It doesn't give you any guarantees in life, but it's awfully important.
Awfully important, and it goes a long way towards close to a guarantee.
All right, now, once again, urology group, and when should a man first see a urologist in order to be examined? About what age?
Well, the man should really firstly see their primary care doctor. I mean, urologists, frankly, are not set up to examine the entire population. And that's why people have PCPs and should get regular health checks. But they should see their PCP. Certainly African Americans at the age of 40 should be starting to be concerned about prostate. The rest of the men maybe at around age 50. If there's a family history of prostate cancer, then perhaps at that 40 age for the rest of the population. And we're starting to understand now, Bill, interestingly, that there are links that we didn't appreciate before between prostate, breast, pancreatic, colon, and some other cancers. So if in your family you have a bunch of female relatives that all had breast cancer, you may well be at more risk for prostate cancer as well.
In the future, say I would have you on in 10 or 20 years from now, Dr. Gary Kirsh of Urology Group, where will prostate cancer screening be like in 10 or 20 years?
Well, I think it'll be better because we're constantly refining the process. There's new agents that we can look for in the blood, other than the PSA, that are under study right now, so that we don't have as much controversy around this. So the controversy around PSA, yeah, it can be elevated. It's not always cancer. We get that. We do the best we can to limit the tests as appropriately as we can. But if we have new tests, which we will, that are more accurate in terms of detecting cancer or no cancer, then it's going to refine our screening. So that's coming along. Also, the imaging of the prostate with scans. We're now using more MRIs than we used to, and those are going to come along with PET scans and other technologies as well. So like everything in medicine, there's going to be a lot of advances. And, of course, the advances we have in treatment, which are beyond, perhaps the scope of this call, are also moving forward tremendously.
All right, Dr. Gary Kirsh, Urology Group, thank you very much. And you would encourage men who have delayed getting their treatment or delayed getting their exams. Now it is September is National Prostate Awareness Month. This is the month to get it done. And this is one of those cancers like colon cancer. When you catch it early, it's always a big deal to have cancer. But if you catch it early, it's very likely you're going to have a much better result than you let it get fired up. I have a friend of mine that had not seen a urologist ever, and he was in his early 50s and had a PSA of 55.
Yeah.
And he's still fighting like a warrior poet some 10 to 15 years later. And all I do is encourage men to get tested. It's not a big deal. And forewarned is forearmed. And Dr. Gary Kirsh, Urology Group, you're a great American, and thank you for coming on the Bill Cunningham.
Thank you, sir. It's great pleasure.
God bless you. All right, let's continue with more. Blind